Hope Citadel Healthcare is a community interest organisation that is set up to deliver GP services in areas of Greater Manchester in deprivation, and we want to provide really good healthcare that transforms individuals and communities and families and tackles the social determinants of health. Some of the unique or unusual things about Hope Citadel is we are a not-for-profit organisation. We try to make sure that our structures are quite flat, so there's not a huge hierarchy. We are hugely focused on looking after the whole person, so all the factors that impact their health, not just the clinical presentation. And our motto is we find the invisible and make them visible. So people who aren't seen in the healthcare system, how do we put a focus on them? And that's where Focus Care came from. We talk about finding the story behind the story. So if, for instance, a young mother is presenting with anxiety and depression, you could clinically prescribe an antidepressant or send them for some counselling, but the factors that are leading that depression will still be there. So she may well be in relationship problems or have debt problems or be struggling with her children, and actually when you understand those factors you can put in support that enables long-lasting change to happen. And what we find in areas of deprivation is that the stories behind the stories are really important. So quite often people's lives are messy and complicated, and you need to understand that before you can work out with them how to move forward. We employ people who are people. So we employ people who are friendly, who want to get to know people. We have a variety of access routes into the practice, and for patients who are particularly vulnerable, we will bend our own access rules to make sure that they are seen. We have an outreach programme which is under the umbrella term of Focus Care, where we go out to visit people in their own homes and find out what's really going on, and then work with multi-agencies to solve some of their problems and get them out of it. So what I think is most important in looking after people with complex needs is to see them in the first place. So often these people are missing from our data sets. They're not on our QOF registers. So for instance, we have no mechanism in primary care for tracking safeguarding of children, and yet these are the most vulnerable children in our society. We're not very good at seeing trafficked people. So before you can help them, you have to see them. And once you see them, then you can step into what it looks like to help and support. But if you don't see them, so the biggest thing I would say is don't be blind.